We are Europacolon Portugal, and this meeting is about the pancreatic cancer. I am the CEO and the president of Europacolon Portugal. This is our international connection with Digestive Cancer Europe, with World Pancreatic Cancer Collection and Pancreatic Cancer Europe. We are already connected with a new association that is carrying the neuroendocrine tumors. I belong to an ethics commission for the best research center in Portugal, that is I3S, and also a senator of a SIC TV show about oncology. What is the missions of Europacolon Portugal? It's to support digestive cancer patients, family, and caregivers, try to raise the awareness of the disease, because in Portugal it's very rare to talking about pancreatic cancer, try to develop the early detection, and a new way of see this problem for the stakeholders and for the professional of the National Health Service in Portugal. What Europacolon Portugal is already delivered to the citizens in Portugal in this moment. We give a second medical opinion. We have two permanent helplines. One of them needs a generic one, and the other one is for the colonoscopy preparations. We increase the primary prevention in all our papers and in all our presentations. We have psychologist consultations and nutrition counsel, social support, volunteer groups, also juridical support, special group sections, let's say about stomach patients. We make the transport of caparage logistics, and we have a special project for home patient in palliative care program. And we training and support also the caregivers. In Portugal, in this moment, no, in 2019, we have 1,619 incidents and more 1,500 mortality about pancreatic cancer. What we need to change in Portugal about the pancreatic cancer, what type of actions we need to do. We must increase the early detection and prevention, of course. We must involve in the primary care center doctors. I think this was the best and the most important point for the cancer tumors to be known and to be detected at the time that can be surgical removed. We need more funding for research in pancreatic cancer. We must put the pancreatic cancer in the daylights of the disease in Portugal and all the stakeholders. We must to increase that the pancreatic cancer must be treated in the excellent centers philosophy, because we need volume for physicians and for surgeons to have results and good results in the treatments. We must increase that all decisions about the people that have symptoms of pancreatic cancers must be made by MDTs, and we must disseminate the local where we can have clinical trials. We must increase in Portugal, of course, the number of palliative care units. Also, you must support the survivors and the caregivers, because in Portugal we have more than 1 million caregivers for all the chronic disease. And this kind of people that works generously, free of charge, sometimes they are burnout, and we give during the year some workshops and some help and support by phone or personally to the caregivers, the families, and also, of course, the survivors. We must, near the stakeholders and the government, promote the access to the best treatments and to promote also emotional, nutritional support to patients, family, and caregivers. In Portugal, it's very difficult when a patient begins the treatments, have available the nutrition programs and emotional programs, because we thought that these two balance, it's very, very important, not only for the patients, but also for the families. As I said already, we must increase the research and the funding for the research. Sorry. And we must promote the access of current databases in oncology. Let's say in Portugal, we don't have, and I think in Europe also, we don't have the databases about the cancer up to date. And when we know the database is up to date, we know the efficiency of the treatments, we know what type of cancer, pancreatic cancer we have, and we must know the best therapy for each people, because the genetic, as you know, of course, it's very important, and they have a good, important connection with the results, the good results of the therapy for cancer patients. What we in Europacolon Portugal understand that can be our stage in the as PCE member. We must develop a cooperative work around pancreatic cancer with experts, academy, patients, organizations, physicians, policymakers, and pharmaceutical companies. We must raise lobbying with the important decisions on pancreatic cancer and the financing for the disease and also for the research. We must improve, PCA must improve the work and to know what's happening in each country about pancreatic cancer. I think that PCA must be not a strong support, but must be together with the members in each country and to improve the care for the patient. Let's say what we think that PCA must do is to know what is the best for early diagnosis, what is the best for the new treatments, and try to see with the members of PCA if in each country they can be actually put available for all the patients. And of course, PCA must develop Europe global strength to change the future for a more brighter one, because as you know, we have the pancreatic cancer will be the next year, perhaps the second mortally disease in Portugal. Europacolon Portugal has already made 60,000 of these kind of leaflets about the symptoms and the risk areas. Also a pancreatic booklet about all the details of disease. And we have shared of them for all the primary care centers in Portugal. This is some interviews in the TVs with patients, with our physicians and myself about pancreas and the needs to pay attention for a quickly diagnosis of the disease. You can see more patients, more surgeons talking about this matter in the media. The media can have a very good and a very important role to put the pancreatic cancer in the daylights of the people in Portugal. Its newspapers, the best newspaper in Portugal, has already put on them by our demand some articles about pancreatic cancer. more details, more workshops, more. It was the World Day for Pancreatic Cancer, that is Europacolon Portugal, that organized every year. This was the last year. And of course, together we need to demand better and to demand more for this fatal disease that in Portugal, as you saw, kill 1,500 people by year. What we need for an organization that can be PCE, it's to be near the members in each country, and also to develop a general philosophy, a general policy about this disease, not only in Brussels, not only in European departments about the decisions for what we need in each country, but also to recognize the good work that some members have done in each country and to help by example to the others that was in the beginning or don't have work a lot about cancer patients.
Thank you.
I belong to a federal also digestive associations, and after COVID, also in Portugal, we have afraid for the near future about the chronic disease that are not COVID. And I think it's very important that the global federal associations about the disease, in this case, the pancreatic disease, can generate a common philosophy to have strengths for the government, the local governments, and also the European level, because we are in the middle of the BECA, the Beating Cancer Program, and to have some funds also to develop the research for new treatments in pancreatic cancers. We have, as of course you know, at almost same level that 40 years ago. And with the other disease, bowel cancer, liver, gastric, they have some development about new treatments because the countries and the European funds finance this type of new treatments. And the pancreatic disease, it's the poor son about the oncology disease for us.
Thank you.
Yes. As you know, we are in PCA since 2014, I think, with the beginning. And what we think about PCA, and only we can give our experience. We have 1,300 members in Portugal in our associations. We have the best connections with academy and with research center. We are to promote a lot of service for all the people in Portugal. And we have a lot of experience of the good things, not so enough good things for the people. And I think we can change or exchange with the other members to the other countries what will be the best for that PCA develop this role that was to make different things and to make a best role in each country for the people don't suffer so much and don't die so much, let's say, to have prevention and to have early diagnosis in each country.